The overall air quality in Delhi deteriorates to the very poor category. It's coming in at 306 points. The IMD has gone on to say that the quality is going to worsen between today and tomorrow due to unfavourable weather conditions. This has prompted the Commission for the Air Quality Management to invoke a stage 2 of the graded response action plan measures. And meanwhile, when we talk about the overall air quality index in Mumbai, that stands at 127 in the moderate category, as per suffer the air pollution as far as the NCR region is concerned. This is going to get worse, and do remember it's the run-up to Dussehra. The Air Quality Panel has asked authorities in the NCR region to increase parking fees in order to discourage private transport and enhance the services of CNG or electric buses and metro services. The use of coal and wood-fired stoves have also been prohibited. Now, so the stage 2 of the graded response action plan has kicked in, so stricter curbs as far as the Delhi NCR region is concerned, which includes the use of diesel generator sets that will be regulated. The use of public transport will be encouraged, metro services as well as electric buses. Construction activities to be banned. Parking fees will be hiked as far as private vehicles are concerned. And now you'll see those water sprinklers back on the roads of the NCR region in order to bring down the pollution levels. Open burning of solid waste, biomass, that will now be avoided. Well, we have our guests joining us in order to get us more on this. We have Dr. Khilnani joining us, as well as Ronak Sutaria. Dr. Khilnani joining us to get us more as far as the pollution levels are concerned. Dr. G.C. Khilnani, Chairman, PCRI, Institute of Pulmonary Care and Sleep Medicine. We also have Ronak Sutaria, founder of Living Sciences Private Limited. This is India's first low-cost air quality network that's built Atmos. Thank you so much for joining us this morning. Let me take my first question to Dr. Khilnani. Doctor, if you could take us through the kind of impact that you see when it comes to the people here in the NCR region. We all know pollution kills. We all face this perennial problem every single year. The pollution season has officially begun. What can we do for the elderly and the children who are most vulnerable?
So, Divya, this is today, but last Monday I saw my number of cases increased by 30-40%. Majority of patients were coming with increased cough, wheezing and shortness of breath. And when we did the X-rays, they were normal. There is a test for airway inflammation called fraction of exhale nitric oxide, which was immediately raised in all the cases. This is actually 7 to 10 days back, and today we are entering into the worst phase of air pollution. The question that you asked as to what elderly should do and how the children can be protected. These are the two vulnerable groups, and those who have chronic lung or heart diseases. So as far as the general population is concerned, I must tell that they must not go for early morning walk when the smog is there, because pollutants are at the breathable and stage. And as the sunshine comes, because of the inversion, the pollutants will go up. That time, if time permits, people can go for their morning walk and exercise, because during the exercise, the air breathed in is 5 times more, and your nasal filter is bypassed. Another thing I would like to say that you must not go to the crowded places like busy markets, especially those who are susceptible and elderly, because there the air quality is extremely bad and your health may be affected. You may feel that use of mask is useful for air pollution, but unfortunately the simple mask which we were using during COVID and 3-ply surgical mask has absolutely no value for preventing air pollutants from entering your system. What one can use, if necessary, can use N95, and better one is N95, which can give some help, but the scientific evidence is not there. A word about air purifiers, which everybody is buying and keeping thinking that is breathing a good air. That should, in my opinion, be used only by people who are elderly and those who have chronic lung disease, are on oxygen or continuously on nebulization. They have no value for healthy people. This is what the science says. Summarizing it, that people who are susceptible should be extremely cautious, because at this time what we are watching, that there are more admissions because of respiratory and lung diseases. And this is not, this is absolutely evidence based, because 30 years back that the study conducted at the All India Institute, there was 22% increase in heart attacks, asthma and COPD attacks. So this is from my side. Thank you.
Right. We also have Ronak Sutaria joining us. Ronak, stage 2 of GRAP has kicked in as far as the Delhi NCR region is concerned. In your opinion, what kind of a difference would that make to the air quality, and is that enough?
I think definitely, it will help. I'm hoping it will help. We've been looking at highly granular data from across Delhi NCR, but also across Mumbai and other highly polluted cities. We're seeing a complete, citywide deterioration. So in Mumbai, actually, we did a deep dive and we found that 22 locations have worsened in October 2023 as compared to October 22. So definitely there is something happening, because almost every location is up by between 50% to 100%, in terms of the same 20 days of last year as compared to this year. So it is a concerning situation. The data from the ground is showing us that the situation right now, and the haze is all around us.
Ronak, so construction is one of the major contributors when it comes to pollution, and that is what we are talking about when it comes to Mumbai. In Delhi, construction activities are going to be banned in order to bring down pollution. Is that really enough? Does it work?
So that exactly, and the construction dust has been attributed to be a big component, but going by the haze, and ultimately haze is a chemical composition actually. So there is a lot of secondary pollutants also coming into the picture here. We were looking at the rise in the gas pollutants, specifically NO2 and ozone, which are byproducts of industrial burning and vehicular pollution. And all of that has actually gone up in the same 20 days of October. So there is something definitely happening right now. Maybe there's more. But what the ground data is showing is that construction dust is one part of the story, but most definitely not a complete picture, and it is not going to significantly improve just by bringing in the construction dust policies. So they are necessary, but definitely not sufficient. I think you need to look into the gas pollutants, which we've just started doing for the month of October, and the NO2 and ozone, particularly the haze, is composed of secondary pollutants, secondary organic aerosols and secondary pollutants like ozone. And we are finding that an increase in that is definitely, the haze is a very good indicator of what's going on in the city. The ground level data, of course, is necessary. So effectively, what we are finding is that construction dust is one of the three or four sources which need to be controlled. But there is a lot more that needs to be looked at beyond construction dust, including for Mumbai. Delhi, for sure.
Ronak, are there any quick fixes that one can incorporate at home in order to deal with the toxic air?
Quick fixes is a tough one. In fact, the indoor pollution tends to be worse than outdoor pollution. So when we ask people to stay indoors, and if they have not fixed the problem, they're actually going to be in a concentrated environment for a longer time in a closed environment. So as the doctor said, unfortunately, at this stage, the N95 mask is one measure. It may not be an adequate measure. The N99 mask that the doctor attributed to is, the particulate part of the pollution it will hold out against. The gas part of the pollution it will not help against. But precaution, frankly, is one most important aspect. The sad part is I think medicines are going to be needed. I mean, I have an infant toddler, and we had to put him on meds last winter, and we are trying to see what is going to happen this winter. But unfortunately, medicines are a part of this whole equation, and the government should bring significant relief in terms of cost and availability. The sinus medicines go out of stock frequently. So this has to be a multi-pronged initiative at the government level, and a lot more needs to be done than what we are currently observing. A lot of these visual smog, these water things are completely ineffective. I think every scientist that we've interacted with have said that smog towers, these spraying guns are like running air conditioners in the open. They are not going to take care of your heat or your pollution. Visually, they create awareness that there is something happening, but from a solution perspective, they are woefully inadequate, and from a cost perspective, they are a distraction to what really needs to be done. So we
Right,
would strongly
Ronak,
recommend.
like you said, water sprinklers and these smog guns are ineffective when it comes to outdoor spaces. It's also the run up to Dussehra. So, isn't it time that, some very strict actions are taken in order to ensure that when it comes to at least Dussehra, that the burning of Ravan and all of that should at least be controlled as far as the NCR region is concerned?
I mean, Divya, I remember at least 3-4 years back, you had done a story on the Ravan burning and you had carried a monitor, and I recall being on that show. But frankly, yes, those are our traditional aspects of our culture and daily living. There is going to be a contention saying that one evening is not going to help, fix anything. But for the vulnerable who are coughing incessantly, that one evening does have a huge impact. So on that count, I would say that the Diwali night and the Dussehra night, if there is a way to reduce, if there's just a light-based celebration rather than, a fire-based celebration, I think it would most certainly help the most vulnerable, as the doctor said, the two age groups of, those under 5 and those above 75 is, I think, what we are really trying to work towards over here. And I think the only request that can be made is to celebrate with as much light as possible and as little burning as possible.
Right. So, Dr. Kilnani, you did mention you're seeing an uptake as far as the number of patients that you're seeing over the last 1 week. Take us through the common symptoms. Is there an uptake in the numbers in the pollution season, say, over the last few years?
So I have been following this for last 30 years, looking at my age, and the studies that we conducted, including the TERI, there is a distinct increase, not only the morbidity, the mortality also goes up with each rise in 10 micron of PM10 at that time. So another thing I want to say, Divya, that this is for the general public to understand, that whenever the cough occurs, it's not necessarily an infection, especially at this part of time. I have seen patients coming who have gulped 3 courses of antibiotics, and then they don't get relief, and they go from here to they go to the chemist, buy a course of antibiotic. This has 2 implications. One is their diagnosis is delayed. Some people land in the emergency, and there's a distinct increase in the ICU admission as well as mortality. So my take would be that please don't gulp antibiotics if you have a cough, sore throat, running nose or headache. Please seek opinion. That is what is important. The patients who have asthma or COPD, which is the commonest condition, here I would like to point out, when I started practicing, the nebulization machines were very rare. Very rarely people used to have nebulization. Today, if you have a child at your home or infant at your home or elderly, majority of you own a nebulization.
Right.
What does it indicate? That this problem has gone up. Again, Mr. Ronak has said, this is, coming on TV and telling everything when Diwali time or Dussehra time is one part of it. But this is a quick solution, actually doesn't help. And
absolutely, Doctor. It's a perennial problem, and it's not just a Delhi NCR problem. It's a pan-India problem that we all need to, have more measures in place. The stage 2 of GRAP has kick-started as far as the NCR region is concerned. The Environment Minister is also holding a meeting in order to ensure a strict imposition as far as the measures are concerned. Thank you so much for joining us on the broadcast. I'm afraid I'm totally out of time.